When people have chronic pain, our next guest says all too often they choose invasive procedures or injections before knowing all the non-surgical options. So if you are in pain, what steps do you need to take to make an educated decision? Joining me now is Dr. Richard Carpenos from New England Spine and Disc with one of his patients, Francine Algieri. It's great to have you both with us, and welcome back, Dr. Carpenos.
Wonderful to be back here, as usual.
All right, so walk us through about what happens when somebody's in chronic pain. What do they usually do?
The usual. Well, first of all, I should say first that New England Spine and Disc is a revolutionary way of taking care of spinal disc problems without the surgery, without the injections, without the medication, without any invasion. This is like high-tech stuff.
You're trying to prevent people from having to have surgery,
Correct.
Is that right?
You got it. But not only to prevent them from having surgery, but also prevent them from going through all the typical things that our society thinks is the way to go.
Okay, so what do people typically do?
Right. Typically, you wake up with back pain, you may take some pills, Advil, whatever you have over the counter. It doesn't go away. You go to the internal medicine doctor who has to know a lot about a lot of things. He prescribes prescription medication. That doesn't help in most of these cases. Then he sends you off either to the orthopedic surgeon or for an MRI. Either way, you find out you have a disc problem. You go through physical therapy. You go through epidural steroid injections, which are ineffective, have no efficacy, do not correct anything. And I mean, for instance, we have this Affordable Health Care Act, Jocelyn, supposed to use clinical outcomes assessments to determine the standard of care. Well, epidural steroid injections have no place in the system.
All right, the process that you just described, You're saying basically that that may not be the right approach. Why?
Well, because number one, it leads you to surgery, which has about a 30 to 40% overall success rate. It's painful. There are so many risks. Even with epidural steroids. I mean, the Mayo Clinic says that epidural steroids can weaken the bone, can weaken the muscle. It can cause deterioration of the cartilage and the disc, and it actually worsens the condition. Even if you get some short-term relief, it doesn't correct anything. So we are about correcting it. Does it happen 100% of the time? Obviously not. But your chances of getting it done this way are so much better, and there's less risk. What could be better than that?
You actually brought a demo here to show us exactly some of the non-invasive procedures you offer at New England Spine and Disc. But before we do that, let's get Francine into the conversation. All right, Francine, how long have you been seeing Dr. Carpenos?
For only about 2 months.
And why did you need to see him?
I was in chronic pain. My spine felt like glass. That's how difficult it was for me to move. I already had the injections, which did not work. My sleep was affected. I tried other chiropractors. So with that, I just decided that my health was the most important thing, and I needed to correct my spine to the best of my means. And Dr. Carpenos was very effective with my problem.
From a scale from 1 to 10, how much was that pain?
That pain was a good 9 to 10 for a very long time.
And where is it now?
I don't even address it now because
That's great,
I
isn't
move
it?
much better. Absolutely.
And so what did you do to help Francine?
You know, it's amazing. These patients get a new lease on life without drugs or surgery. You know, it even amazes me every day. We start off with this very high-tech Class 4 laser, the New Life laser.
Which you
we brought it here. And they sometimes put a little demo on the air of Pete doing it in our office. But basically, you're penetrating to the disc with light energy. It does the same thing that light does in nature to plants.
There's the video right there.
Right. So you are stimulating the cells to reproduce in the damaged disc cells and cartilage cells. So we could take patients with herniated discs, stenosis, degenerative disc, but it also works on things like plantar fasciitis and knee arthritis and bicipital tendonitis and carpal tunnel syndrome and
Francine, did you have
TMJ.
this done?
It's amazing.
Yes, I
did?
have a diagnosed stenosis of the spine, and I not only had the laser, but I had the DRX treatments and the manipulation. But more importantly, Dr. Carpenos' office offers well-trained physical therapy professionals who then give you the exercises, which are key. So I'm very vigilant to do the exercises, and therefore I minimize the pain, and therefore I minimize the need for NSAIDs, I minimize the need for sleep agents, and I can exercise more, which then makes me more tired, and so I'm in better health.
Well, that's great. Now, she mentioned another treatment, the DR.
The DRX 9000. That's the revolutionary piece of equipment right there. Spine.
We're showing it right here.
Yeah, we're actually using this sophisticated instrument. We can program it to the level of the disc that's herniated or bulging or where the stenosis is, and we can decompress it, create a negative pressure in the disc, and the outcomes for this are amazing. We take patients from a 6.5 on a 1 to 10 scale of pain down to about a 1.2 in every study that's been done, and we actually reduce the size of the disc herniation without surgery, without injections.
And it's really very relaxing for you, isn't it, Francine, to be on that?
It is relaxing, and at first it's painful. However, you have to realize that the spine is being stretched and the blood supply is getting into where it needs to be, and then logically, to me, that was the better route to go, and I'm out of pain and I'm able to move much more freer.
That's great news, and we don't have much time here, but we do want to show everybody how this works.
Sure. So I just put these glasses on for a second.
Okay.
And basically, this is a laser, and it emits a slight warm sensation, and you might see this. I'll just demonstrate it on Francine's neck, and we just use this magnified ball on the end of the probe to drive it into the tissue, and all the patient feels is a nice warming, soothing sensation, but the light gets into the discs and the damaged structures, and it revitalizes them, rebuilds them slowly over time.
Now, how soon will patients feel or see an impact?
Well, one of the reasons why we offer the 2 free visits to Connecticut residents is because you will feel some results immediately. It takes a few weeks to get you where you need to go, but usually patients feel some immediate results even the first time they come into the office.
Excellent, and as Dr. Carpenos just said, they do offer 2 free visits for laser and spinal decompression. The phone number's right there on the screen, or visit the website NewEnglandSpineandDisc.com. Always great to see you here, Dr. Carpenos.
Thanks, Jocelyn. Great to be here. Thank you for having us.
Wonderful, Francine. Thank you for sharing your story.
Thank you.